Hello, I'm Dr. Alexandre Amato, vascular surgeon at the Amato Institute. And continuing Lipedema June, let's talk about what it's like to live after lipedema surgery. This is a very interesting topic because many believe that once lipedema is operated on, the problem is solved, the disease is removed, so it's over. I can go on with my life without worrying about it anymore, and this is extremely far from the truth. You had lipedema surgery and now you have a huge problem to solve, now, which is your inflammatory cause, the source of the inflammation. Oh, but what do you mean? Let's go. I'll make an analogy to explain this to you. But first, subscribe to the channel down below. You can go ahead and scroll down, leave a comment saying if you want to have surgery, if you've already had it, what's your perception of lipedema surgery? So how does this work? Imagine you have a dashboard in your car and there's a little light blinking red. Some people will take this car, go to the mechanic and say, look, I want you to find out why this light on the dashboard is blinking red and fix the cause of this light. Now there are other people who will take this car, go to the mechanic and say, this red light is bothering me a lot. I want you to remove it and cover that hole in the dashboard because I don't want to see this red light anymore. What's the right solution? Write it down below. In the comments, I want to know, what would you do with your car? Now, what would you do with your body? Imagine that lipedema, the fat deposited in your leg, is a signal from your body warning that there's a much bigger problem happening, which is inflammation. Some people go and say, remove this fat from my body because I can't take it anymore. The inflammation will still be there, but I can't stand seeing this fat anymore. Other people see the problem and say, hey, I want to solve the inflammation. After the light stops blinking, if I really don't like it, off. On my dashboard, I might even remove that light and cover that little hole. As long as I know how to control the source of the inflammation without having that little light anymore. Let's say I'm old enough to drive a manual car and know how to drive a manual car and shift gears without pressing the clutch by listening to the car's engine. Do you know anyone who can do that? It depends on the age. Now, with so many automatic cars, people don't even want to drive anymore. But how can you do it? If you have the knowledge of the car's mechanics, how it works, and you've practiced a lot, you will be able to do it. But if you make a mistake, you'll end up damaging the clutch and the engine. So it's not good to keep doing it. That's precisely why the RPM gauge is crucial on the dashboard of a manual vehicle. When the RPMs climb excessively, it's a cue to shift gears. These dashboard indicators warn us of forthcoming adjustments. If you lack this awareness, it's advisable to steer clear of activities that could pose risks. The same concept applies to lipedema. Same as if you're not thoroughly acquainted with your body. To discern when it's time to shift gears, how can you disregard the indicator prompting you to make a change? Or how are you going to remove the indicator that there's a problem happening in your body? Did I manage to explain myself with this analogy? So what is it like to live after lipedema surgery? You no longer have the inflammation indicator. You no longer know if you are or are not inflamed. Considering the entire population, it is an advantage to know that you are inflamed, because those without lipedema don't have other signs to know they're inflamed. I, for example, could be inflamed and wouldn't know it. It would take me a long time to find out. That's why men suddenly have heart attacks and people say, wow, but he seemed so healthy, and in reality he's been carrying a chronic inflammation for decades now without realizing it. Those with lipedema have that little light saying inflamed, 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 you might get annoyed by that light. And I really get annoyed when the light on my car's dashboard starts blinking. I get angry. Damn it, I need to fix this. I get nervous, but I would never go to the mechanic and say, turn off that light because I don't want to see it anymore. I would fix the cause of the problem. So talking about living after surgery, but I want to make it clear that I'm not against surgery. Surgery can be done as long as the inflammation is completely controlled, that you already know how to control your inflammation, that you already know the cause, that everything's fine. All right, the surgery can't happen because you already know how to listen to your car's engine. So I will talk about life after lipedema surgery, but I will only speak here in the video for those who truly understand that it's important to treat the inflammation first, because many people are having surgery out there without paying attention to the inflammation, and then realize that the surgery caused inflammation in the leg, leading to a horrible post-op full of pain, full of problems. You can join the groups out there of lipedema patients and see a bunch of people talking absurdities about post-op surgery, but it's because they had surgery while inflamed and without knowledge of conservative treatment. The only time to have surgery is when everything is super calm, the sea is calm, no waves, already deflamed, then yes. And this is the lipedema patient. I will now talk about how to live after the surgery. Typically, the post-operative period for a lipedema patient without inflammation progresses smoothly. A slight increase in inflammation is expected, but since the cause is known and controlled, it can be effectively managed in a serene and pleasant manner. It is essential to utilize the elastic compression garment immediately after the surgery. While it may not be as crucial in the medium to long term, using it can aid in reducing inflammation and maintaining comfort by applying gentle pressure rather than for treatment purposes. Certain suitable garments, such as elastic pants, can be beneficial. If you wish to explore fabrics that can help alleviate inflammation and offer comfort for individuals with lipedema, I can provide a link below. Swelling is commonly observed at the onset of the post-operative phase. This swelling tends to decrease over the weeks with lymphatic drainage and post-operative control measures. Regarding immediate and long-term results, the immediate result, what you will see the week after surgery, it's hard to assess because there will be a lot of swelling, there might be a lot of bruising, it might be quite uncomfortable, often there might still be a bit of fluid draining, and this can be quite bothersome. In the long term, we have to remember that if the inflammation has significantly decreased, there will be a very significant aesthetic improvement. Now, I have a patient who came to me already having had 5 previous liposuction surgeries on her lower limbs. So I didn't perform any of them, and the patient came to have the 6th surgery. I examined her and said, look, you really need to undergo conservative treatment, because if not, you will have the 6th surgery, then the 7th, 8th, 9th. You won't finish. You'll never be satisfied with the result because you're not addressing the source of your inflammation. So the expectation is very much tied to conservative treatment. There is indeed a visible and considerable aesthetic improvement. But if you don't resolve the inflammation, you'll continue to be bothered by the appearance of your legs. Now, what surgery does, as you remove a good portion of that fatty tissue, you have a reduction in the target of this inflammation. The inflammation remains. It will affect other organs with other symptoms, but with less fat target that inflames easily in the leg, you'll have fewer symptoms in the leg, so you'll have less pain, less swelling, less fatigue, less heaviness, less bruising in the legs. The improvement of these symptoms is the argument used to perform the surgery, but all these symptoms also improve when we remove the inflammation from the patient. So what happens is you remove a target of the inflammation, which is the fat, which will improve the symptoms in the leg. It shifts the inflammation to other organs. It could be the gastrointestinal tract with more diarrhea, more constipation, with migraines, sometimes with skin lesions. Another very common issue is the alteration of lab tests and the deposition of visceral fat. Visceral fat, the fat in the belly, is the fat of inflammation. It's the fat that inflames, worsening inflammation in the body, and is directly linked to obesity, diabetes, Alzheimer's, and cancer. So, these are chronic degenerative diseases. Maintaining results after surgery. It's very important to have conservative treatment. Very important to maintain clinical treatment. Operating on lipedema doesn't mean abandoning everything you need to do to reduce inflammation. Operating doesn't mean a cure for lipedema. Operating means I removed the target of the fat from the legs, I'll reduce the symptoms in the legs, and I still have the inflammation to resolve. So it's essential, it's crucial that you have a good relationship with your doctor, that your doctor maintains and persists with the conservative treatment throughout your life. Oh, but will I need the doctor for my whole life? No. The doctor is there to help you get back on track whenever necessary. If you manage to take care of your diet, nutrition, do everything right, and remove inflammatory triggers from your life, you won't need the doctor as frequently. However, if you had surgery, remember that you removed that blinking light. You no longer have the warning that inflammation is happening, so you have to be much more perceptive to your body. You have to be more sensitive to changes in your body to understand when you are more inflamed or less inflamed. Now, especially in those cases where I also agree that surgery is crucial, which is when there is difficulty with mobility. So you can't exercise, you can't walk, because the lipedema is preventing that. Then, yes, the surgery is for correcting this defect. In these cases, the procedure will then improve mobility. It's very important to take advantage of this mobility to start doing the right physical exercises to keep the inflammation down. Remember that surgery has many complications, from hematoma, which is almost certain to happen. Although some people say they've never had a hematoma, in reality it always happens. The question is whether the hematoma is large enough to require a procedure, or if it's small and your body will eventually absorb it. There are bruises, the purples, all of this, very frequent, but there are worse complications. There are published case reports of lymphedema post-surgery. There are cases of skin necrosis. There are catastrophic cases. I keep hearing, I get many stories here in the office of people who ended up in the ICU because of a surgery attempting to remove an excess of fat. It goes beyond the limit of acceptable and safe and ends up in the ICU, ends up with severe anemia, needing a blood transfusion. I've seen infections, I've seen all of this happen. And I need to make it clear here that I can't do post-op care for another doctor's patient, even though many people come asking me, I just had surgery with someone else, can you take care of my case now? No, it has to be the doctor who operated on you. If there are issues, they will have to resolve them. Otherwise, I will end up being co-responsible for a surgery that I often didn't even agree was necessary, and the skin laxity that can also happen. In most cases, thinking back more than 10 years ago when I started working with lipedema, I thought it would be necessary to do a lot of surgical treatment for skin laxity. I really believe that, and over the years I realized that it's not common. Sagging happens, Colin, but often the acceptance of the body, the aesthetic improvement is so significant that there isn't this desire to move on to the next phase of an aggressive treatment for that sagging. And there are several procedures that we can do that end up improving. The sagging, for example, laser. And all of this, as long as it's superficial and doesn't cause chemo, local inflammation can help by stimulating collagen, but then we need to differentiate skin sagging from fat sagging from muscle sagging. I have an entire video talking about this if you want to dive into that topic. So medical follow-up is very important. You need to have easy access to your doctor. Here in the office, I provide an easy contact to talk to me or to bring any issue to the secretary at a time when I can address it. I see a lot of people complaining about appointments with insurance, about appointments in the public health system. I understand this problem, but I wish both sides would understand the issue. The demand for conservative lipedema treatment is high because there are many complaints happening due to inflammation, and the inflammation affects the whole body in a metabolic problem. This is not easy to solve. Often, a 15-minute insurance appointment is almost impossible to meet the demand and solve the problem. In that time, often the doctor only has time to write a prescription for a medication to relieve a symptom, and that's it. Regarding this issue, I do a bit of a grassroots effort here, trying to help one person at a time. When someone comes to my office, I really pay attention to the whole problem, the entire metabolism, all the symptoms of the body, but I can only do this one person at a time. To try to help more people, we end up teaching other doctors. We have courses. I try to publish a lot in scientific journals to spread this to everyone. And obviously I can't forget our channel here, so go ahead and subscribe below, where I publish almost every day. We have videos here on the channel discussing important health aspects, and the content is free, folks. There's no excuse not to watch. And to wrap up the video, I wanted to give some tips here. First of all, never operate on lipedema with less than a year of treatment. But where did you get a year from? Oh, I've done a lot of obesity treatments before. Obesity treatment doesn't work for lipedema. I'm talking about 1 year of real, genuine treatment. For lipedema, because 1 year is a reasonable time to lose a volume 2 to 3 times greater than surgery. And in 1 year, most women will even end up giving up the need for surgery. Giving up because they've improved, giving up because the problem is truly resolved. That doesn't mean it will take a year to improve the symptoms. The symptoms improve a lot and quickly. I did a study many years ago where I achieved a 36% improvement in symptoms in 1 month. Nowadays, we have many more clinical tools and we can improve these symptoms much more in much less time. Another tip is never undergo surgery if you are experiencing inflammation. The post-operative period will be bad, you won't like the result, and honestly, you are not treating the cause. Another crucial tip, don't fall for the influencer trap. Understand what's happening in the market. More than 10 years ago, when I started treating lipedema, no one talked about lipedema. Today, lipedema has become a buzzword, and many people want to capitalize on lipedema, and many people want to get a free surgery or have marketing contracts to promote some surgery, some doctor, and they will use you as a bargaining chip. So if someone is pushing hard for a procedure for you, and I know this happens in groups out there, understand that you are probably being used as a bargaining chip for that person. Don't fall for it. Remember that influencers who are paid to show results, they will only show the good results. Those who had bad results are too embarrassed to appear. Liked our video? Subscribe to our channel, share it with your friends who you think might have lipedema, and click the bell to receive notifications for the next video, because we are always publishing, almost daily, videos to improve your health and the health of your family. Stay tuned, I'll put on the next best video for you to watch.